one of the first things we do in this system is we look at alignment. So Aldo, if you can just stand right there and just relax. Don't give me your best posture. Just give me a relaxed posture. Just being in your body. And I'm going to stand back and we're just going to look straight ahead and just be relaxed. So the first thing that I start comparing right to left, knowing that this shoulder is the one that hurts him, and it doesn't hurt him in this position. So this isn't necessarily the best position to assess alignment, but it's a great starting point because if we see anything here, it can impact when he goes and moves. The first thing I notice is that this forearm is much more pronated at rest than this one. And so I'm curious if it's limited in how much it can supinate. And notice that as soon as I start supinating him, he starts moving his humerus over here. So I'm curious about that. Let's see over here, look how his forearm moves independent of his humerus. Do you see that? So I'm able to get him to just move this forearm independent of any movement here. On this side, when I go to move his forearm, he starts moving through here right away. So he doesn't have the ability to independently move his forearm. And can you feel that limitation right there?
Yeah, I can.
So this could be causing the pain here. Maybe. Could be. So this is how we start. We look at alignment, we assess mobility, and then what we really want to do, remember how we said we do a pre-test every time that's unique to the individual? Well, he has a request, Rebecca, why do I hurt doing my triceps in this position? So that's the pre-test I want to see, is what's going on in this shoulder that's maybe not happening over here. So can you just raise both arms straight overhead for me to start out with? So we're getting up into that position that he works out in, and just stay there a minute and let's see what happens. So the first thing I notice is that he really changes the position of his diaphragm to lift his arms overhead, his thoracic spine extended. Did you see that? So bring your arms back down. Okay, here's his diaphragm here. So Aldo, if you take a deep breath, come on back down. Now bring your arms back overhead and do it the same way you did it the first time, where you allowed your rib cage to go this way. Now stay here and now take some deep breaths and tell me if it feels harder or the same to breathe.
It's a little bit harder, like I can feel a sting.
A sting?
Yeah.
Where do you feel a sting?
Kind of weird, like very deep in my, behind my ribs.
Very deep behind your ribs.
Yeah, I would say close to my spine.
So if we say, okay, what would it look like if Aldo was able to keep his diaphragm in a stable position and just lift his arms? And actually, he can do it. He just didn't know he was supposed to do it. But this creates a whole different base of support for his arm to have his rib cage here. Now take a deep breath, Aldo, and tell me what it feels like to breathe there.
Normal.
Normal. Okay, so one thing I would train him, which has to do with bioactive myomechanics and alignment, is to engage his abdominals as a foundation for strengthening his shoulder. Does that make sense? Okay. Okay, so go ahead and come on down again, and then turn around so we can see your back. And actually, if you don't mind taking your t-shirt off, that would be great so we can see your shoulder blade. Zuh. Okay, so we're going to kind of look at where this one's sitting and where this one's sitting. And again, where his arms are. I'm going to step back and look just a second. And what I notice is that this one is a little bit closer to the spine, and this one is further away from the spine. Do you see that? So his resting position and his alignment is different in one shoulder versus the other. So I'm just curious, what if I put this shoulder blade where this one is? And then say, okay, Aldo, as soon as I do that, do you see where he starts moving his diaphragm? So Aldo, can you keep your diaphragm here and do this at the same time? It's tight. Do you feel that?
Yeah.
So turn and face the camera. And so what happens when I say keep your rib cage stable while I bring this back? It's like a tug of war, right? What happens when we do it over here? Keep your rib cage stable and bring this shoulder back. It's not hard.
No, it's not hard.
Okay. Yeah. So there could be a flexibility issue, right? So that's where we might need to do some manual therapy to release some soft tissue structures that are causing shortness from here to here, where he has to make a choice. If I bring this back, I have to change the position of my diaphragm and how I breathe. Or I can leave this here and my shoulder has to stay forward. But we want him to be able to bring his shoulder blade back and maintain the stability of his rib cage so that he can breathe well and so that he can activate his abdominals as a base of support for his shoulder. So his abdominals, if he lifts his rib cage like that, do you see how that lengthens his abdominals? If I were to carry in groceries with my bicep in a lengthened position, I would be at a mechanical disadvantage. I would never say, load me up with groceries. I would always put my arm here so that my bicep would be at a mechanical advantage to function. When his rib cage is neutral, his abdominals are at a mechanical advantage to do their job. As soon as he gets here, his abdominals are lengthened, and his abdominals are like, this is really hard. And so most likely some other area in his body. Do you feel how your back kicks in?
Yeah, it's overcompensating.
It says, I'll stabilize. I'll do it. No worries. Yeah. So here it is. So what we're finding is a length tension differential between one shoulder and the other, and it's affecting his abdominals and his diaphragm. Okay, so that's tightness here. So what I want to see also, if we can, so I don't have the leverage to be able to hold this stable and bring him back. I would need to get him on the table to do that. We'll do that in a minute. We'll test some muscles. But let's see from the back again, because I do want to see this. Go ahead and lift both shoulders overhead. So we saw alignment, and now we're going to look at alignment here. And this is a little bit more active than this side. So to bring his arm up, he's substituting a little bit with this, which changes the alignment of his glenohumeral joint and can cause some impingement in his shoulder joint, and also changes the length tension relationships in all the muscles in the shoulder. So he's got kind of a recruitment differential between this side and this side in terms of how he recruits muscles to bring it up. Yeah. Okay, so let's go ahead and lie on down, Aldo. Why don't you put your head right up here then?
Okay.
And you're going to be on your back, actually. Yep. Yep. So I want to see here, I have a better ability, but see, as soon as he lies down, his ribs are elevated. So this shortness right here in the front of his shoulder is pulling his rib cage up. So if I feel, do you feel how that's off the table right there, Aldo? Yeah. So that is neutral. But do you see how that borrows from here?
Yeah.
Yeah. So we would want to change this length. So here we're already working on the middle core to help the upper core. So that's a good example of how the system's interrelated. Okay, so that's one thing. So right now I can see that one of the primary problems is a myofascial restriction from here to here and here that's limiting normal function of this shoulder. But the other thing I want to see real quick is we'll just look at some muscles. So go ahead and push this arm straight back for me like that, like you're going to that mirror behind you. Okay. So go ahead and push back. And that's really hard for him to hold. Do you see where he can't hold that? So that's a good example of a muscle. He can't recruit it well. Yeah. And now, just as a comparison, bring your hand to your shoulder. That recruits and locks. So when he brings his hand here, he initiates the movement. So it's a concentric contraction. I come in and resist it. It can lock. That was a bicep test. This is an upper trap test, upper trapezius. So he initiates the movement with a concentric contraction. So Aldo, go ahead and reach right back there again. Then I come in, and it just doesn't take any pressure at all, and he can't lock. So to me, that would be a positive finding that he's unable to recruit his upper trapezius. So we want to see about his lower trapezius. Go ahead and bring your arm straight down this way, and don't let me lift up with a nice straight elbow. And don't let me lift up. That's hard for him to hold too. Go straight down this way, straight elbow. Don't let me move you. That's hard to hold. So all of his upper traps, upper, lower, and middle trap are hard to recruit. Bring your hand to your tummy like this, and don't let me move you. So you go down again. Go, go, go. I come in. He can hold that. Go straight back like this into my hand. He goes, I go. He can hold that. That locks. So his posterior cuff, rotator cuff is working, and his anterior rotator cuff is working. Okay? So that was infraspinatus and subscapularis. Here is supraspinatus. Go ahead and straighten your elbow, Aldo, and then lift your arm to the ceiling. Supraspinatus, he can recruit that too. So his rotator cuff is working just fine. Let's look at teres minor real quick. Go ahead and push out this way for me. He's got that too, no problem. Let's look at a bigger muscle group. Let's look at his pecs. Go ahead and straighten your elbow. Bring this hand down to this hip. Go, 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 go. That locks. Bring your hand down to this hip. That locks. Bring your hand up toward that light. That locks. I'm kind of curious about his forearm because that was an issue when he was standing. Go ahead and turn your forearm this way and don't let me spin you back. You can hold that. Go out that way again. You can hold that. So his supinators are working just fine. Go ahead and turn your hand down and don't let me turn you up. His pronators are working. Turn down. Don't let me turn you. But look at how much he substitutes with his upper arm to do that. He wants to bring his elbow out. It's not because he can't recruit the muscle. He can recruit the muscle. He just has a movement imbalance. Go ahead and turn this down. Aldo right here, and look how he wants to cheat with his thumb. Don't let me, that's okay. Go ahead and turn because he actually doesn't have that muscle in this position. So I'm really curious to see, does he have that muscle over here? And does he have his upper trap, middle trap, lower trap over there? So let's test those. So we're going to get in the same position and turn his forearm down. So we're looking at his pronator teres. And don't let me spin you. You can hold that all day long. Do you feel the difference? Yeah. Okay, now let's look at your upper trapezius. So nice straight elbow. And then go straight back, Aldo, toward that mirror. Feel how that locks? It didn't lock on the other side. You feel that difference?
Yeah.
Okay, go straight down to the floor. This is lower trap. That locks. And straight down this way. And that's middle trap. And that locks. So let's just see if we do bioactivation and we work on improving the position of his rib cage and the head of his humerus, and see if that changes how his muscles recruit. It may or may not. But we know that if we don't fix this, you're not going to be able to move correctly like you move in this shoulder. So you're having to do a lot of substitution just to get your arm overhead, right? Does that make sense to you?
Yeah.
Okay. So what I'm doing first is I'm evaluating. And what am I feeling? I'm feeling for rib mobility. So I'm looking at the osseous system. We just had an idea that we were going to go into the soft tissue, but I'm looking at how do the bones move? That bone does not move back. Do you feel how that one moves? This one doesn't. Can you see that in the video? Yeah. These ribs will move down, but this does not move back. So this is really locked. So why is it locked? Is there tissue right around the joint that's limiting it? So I'm going to see some. I'm curious if I bring his forearm into supination, does that change this? A little bit. Let's move you back down here. So sometimes changing the tissue here in the forearm will change the mobility of the humeral head. I'm not seeing that addressing his forearm is changing his humeral head. So that's not where our solution lies. What if I move to his biceps? That gives us more spring in your shoulder. Do you feel how that loosens it up?
Yeah.
So guess what? That's where I'm starting. So remember when Jeff asked that question, what about in a typical physical therapy setting where you have less time with a patient than I have with a patient? Can this system be effective? Yes, because I just boom, I'm doing a lot of explanation, but I'm kind of quickly finding where do I need to work to change this situation. So I'm feeling his biceps will move down, but do you see how his tissue does not move up? And can you feel that, Aldo? Like I can move you down, but I can't. When I move up, your tissue just holds.
Yeah.
Yeah. So I'm going to start with a direct approach, just coming in directly and seeing if I can get this tissue to start lifting up. And so I'm feeling, I've got my hand down here because I'm playing with this lever to pull up fascial lines. If I don't do that, do you feel how different that feels?
Yeah.
Then when I've got this lengthened, it's popping that layer, that fascial line that I need to work on. It's bringing it up to the surface so that I don't have to work as hard to get to it, and so that it's really, really obvious where it is. Mm-hmm. Yeah. And so I'm tractioning his arm to create more tension in this area to bring this layer up to the surface. So when we're doing bioactivation, we're thinking about working with the tissue three-dimensionally, and we're thinking about how the whole system affects this one area. So I'm not just having my hands here, I'm working with his whole arm. And here I could feel where his forearm is feeding right into that fascial line. That's the same line. Do you feel that?
Yeah.
Okay, so here we've done a couple runs, and if I don't have much time with a patient, I want to make sure I'm spending my time in the right place. So I'm going to come back up here and retest. That moves with more ease. I don't have to push as hard. Do you feel that?
Yeah.
Do you see where this doesn't move as much in response to moving his shoulder now? So I could stop at this point and go ahead and stand up, Aldo. I would like to do more, but let's just see. Can I now bring his shoulder back without him popping here? Yes.
Yeah.
You feel that?
Yeah.
Yeah, so that's how quick we found right where we needed to work. Just took a couple reps right here. Now, go ahead and bring your arm overhead.
This one?
Yeah. Why are you laughing?
Sorry, it's just there's absolutely zero movement in his ribs.
Yeah.
It looks really different. Does it
Solid,
feel
yeah.
different to you?
Yeah, because like I used to do the ribs because I felt like the movement limited, so I did that like at least subconsciously. That's what I'm.
Yeah. So does that feel different to move your arm right there in this moment? Okay. So how much weight do you normally play with?
For that specific exercise?
Yes.
I think it's 25 pounds.
25 pounds. Mm-hmm. Do you warm up with a lighter weight first?
Yes.
Okay, like what would be the lighter weight that you would use?
20 pounds.
20 pounds. You'd start with 20? Mm-hmm. Okay, and that doesn't hurt your shoulder?
No.
Okay. Jonakai, could you please run to the gym and grab a 20-pound weight? Mm-hmm. And then I'm going to bring this back down, and I'm going to have you turn and face your back toward the camera. Mm-hmm. And so I'm just curious where the resting position of your shoulder blade is.
Whenever I'm holding the...
Just at rest. Because remember when we first looked at you, this was closer to the spine than this was. Mm-hmm. This is still further away, but it's not quite as far away. Mm-hmm. Do you see that, Violet?
I do.
Yeah. Okay. So go ahead and face forward, and let's give you this weight, and go ahead and bring it overhead. And talk to me. Does that hurt?
No.
Does it usually hurt?
No.
Okay. When does it start to bother you?
Whenever I do this.
Okay.
Yeah. I felt it more like on the lateral side than on like the actual the triceps.
So typically you would hurt here, is that what you're saying?
No.
And right now, this is where you
This is
always
where-
hurt.
yeah.
This is where you always hurt.
Yeah, but
Is-
this time like it went immediately to then. When usually like when I'm warming up, I can do like a few ones, and then it starts hurting.
And right now it just quickly went right to here. Okay. So let's go ahead. So that was a good learning. Let's go ahead and take this weight down and go ahead and lie back down on the table. So if I'm trying to work efficiently, I could feel that there was more to do here, but let's just move on and make sure that we're right where we need to be. So now it's clear to me that I need to get his arm in this position. You can hold it with your other hand if you want. And it's his scapula follows his humerus. It's not able to stay down. It's up and lifted off of his rib cage. Let's bring this arm up. Jenica, can you get that on the video camera? Do you see where this scapula is? It sits against his rib cage, and this one pops out. So this, his scapula is really lifted away from his rib cage right over here. So we're going to just release right in here in his subscap, because we want his humerus to be able to move independent of his scapula. So right here. So come down just a little bit, and now start reaching towards your other shoulder. Now reach. And then come back towards me.
Do you want me to use my other hand for this?
Sure.
Yeah.
And then go again. Good. And then come back. And then go again. And then I'm going to help bring these ribs down a little bit right here. Good. And go again. And right there. Good. And right there. Good. And right there. So we're really working at trying to help his rib cage be able to stay down and be stable while he moves his arm above. Yeah. And now what I can see is that there's binding right here, right back here a little bit. So I'm going to come right back here. Can you feel that line, Aldo, right there?
Yeah.
Yeah. So now start bringing your arm back into that same position. So see how this treatment is specific back into here. This treatment is specific to his complaint or to what Aldo wants to be able to do. We're going right into that movement pattern. Good. Yeah, there's a fascial line right there. So my fingers are kind of coming right up like this through his deltoid, through that, and we'll do 2 more runs. 1 and 2. Okay, good. Now, let's just see how far we got. Go ahead and stand up again. And go ahead and grab that weight.
Okay.
This feels like a heavy weight. Okay, go ahead and go back through the movement pattern. Talk to us. Ouch.
Yeah, like, so I felt it the first time. I felt it more on the lateral side. Now I feel more on the medial side, actually.
Okay, what do you feel here?
Nothing.
Nothing.
Yeah.
Okay, so this pain is different.
Yeah.
And now he's able, can you see where his humerus is actually coming up a little bit more? And he's starting to get impingement here. So I need to do a little bit more work. So bring that back down, come back on the table. We need to keep going where we were, where we left off.
I'm so sorry for making you do all this.
No, you're not making.
Oh, my broken shoulders.
No, right here. But see how we test and retest, and it lets us know where we need to go. So he needs to be able to get his humeral head to glide down when his arm comes up. So we're restoring the normal arthrokinematics of his glenohumeral joint by releasing the tissue all the way through this arm, all the way out into his hand and forearm. And back into the front, because now that we release the back, his arm is able to come into another position, so a whole nother layer right here is showing up that didn't show up before because his arm is really in a different position. Yeah, right there. And then we'll do one more. Okay, Aldo, go ahead and stand up again.
Of course.
This time without the weight.
Okay.
And just go through the movement pattern.
Facing this way?
Actually, yes. So there. Right there. Exactly. That's it. That's it. Now bring the other arm up simultaneously and bring them both behind your head together like you're doing this simultaneously. Go ahead and do that movement. Yeah. This is looking more even, and this position actually looks even a little bit better than this side right now, where this is able to go. Okay, so how does force move through this arm and into the system? And you see how that is not quite as stacked on this side right now as this side. Can you feel that, Aldo?
Yeah.
Yeah. Okay. Good. So let's go ahead and grab the weight and go in. And you can, why don't you face forward, because that's how you were doing it every time. Yeah. So drop right here. There you go. And then, and actually straighten it and just hold it right there. And bring your wrist. Can you tell that your wrist is, there you go.
Yeah, like that?
Now just hold that. And now punch that whole arm to the ceiling. And now let it come down like that. And now reach to the ceiling and come back down. And reach to the ceiling and come back down. There. From that position, start to bend your elbow. And now come back up. Now that is using your tricep more.
Yes, it definitely is.
Do you feel that?
Yeah.
Is that binding and hurting in here?
No.
Is it hurting here?
No. Like when you did let go, I kind of felt that a little bit.
Where?
The more medial side.
Because this weight is actually too heavy for you to do in this position. I'm going to bring it down. So what we just did is we changed the alignment of your arm and we changed the way you recruit muscles. So in the old position, you actually could produce more force than you can in the new position because you haven't been here before. So we would need to take a lighter weight.
Yeah. Kind of like work my way up again?
Yes.
Okay.
And how remember we talked about taking the pattern and breaking it down into components. So let me get right here. So this right here, reaching to the ceiling and coming back down, is a component of this activity. You have to know how to be able to set your scapula before you begin to move your elbow. Or it could be in a variety of positions that could really cause compromise to the joint. So we need to let this be able to come down, let your abdominals be able to be here, and I want you to practice having a weight, and it can be that heavy, and just punching to the ceiling and coming back down, and getting that feeling of how to do that. Straighten that elbow. There you go. Up and down, and keeping those ribs down.
Oh, okay.
Do you see?
Yeah.
Do you see? And keep the elbow straight. Do you feel how, there you go. There you go. There you go. There you go.
Oh, I feel like I worked out right now.
It's surprising.
That you haven't used before.
Yeah.
At least for this action.
Yeah, so when you really start breaking it down into components and elements of movement, you start isolating where the problem really is. So he's fatiguing right here with no weight.
Yeah.
So to add a weight to this arm in this position is inappropriate, and he's in a much better position. But as he gets stronger, he'll be able to do that. Now, go ahead and leave your arm here and then bend your elbow into that tricep press. And I'm going to get right here and go ahead and push up. But I want you to push from here.
Okay.
So, exhale and straighten your elbow. There. There. Come back down. Exhale. Do you feel how this can support this?
Yeah, yeah.
Or you could not use it at all, and you can bring your rib cage back where it was. And do you feel how that is just a lot more load on your shoulder?
Yes, it's all on the shoulder, yeah.
Yes. Now
Because I'm
drop.
not stacked, right?
Right. You're not stacked. You can feel that. Here, now, you're stacked. Drop that down. And now from here, push me up. Push me up. Is that painful?
No.
Okay. Right here. Push me up. Push me up. Push me up. Good. Right here. Push me up. Is that making your tricep work?
Yeah, a lot.
A lot. Right here. Push with your abs. What's the whole point of doing this exercise?
To get my whole body into it?
Yes, but to strengthen your tricep, yeah?
Yeah, too.
Is this fatiguing your tricep better than that big weight was?
Way more.
Way more, because the accuracy and the precision just went up.
You
So we're really
isolated it.
isolating the right muscle. Yeah, yeah. There you go. So guess what your homework is? Your homework is a heavy weight, punching and dropping, keeping this engaged, and then taking a lighter weight and
keeping the-
exhale and press. Maintaining this new position of your scapula. Okay, let's just see if changing the orientation of your shoulder girdle and your ribs changed your ability to activate those muscles.
Okay.
So let's come back here and lie down on your back. So we're going to come back to his upper trapezius. Go ahead and push back toward the mirror, Aldo. Push, push, push. Do you feel how that can lock?
Yeah.
Okay.
That was one of the ones that didn't lock, yeah.
That's right. Let's do it again. Make sure you really have it. Straighten that elbow and push straight back. You go, I go. That definitely locks. It was even stronger that time because your body's starting to wire it back in.
Yeah.
Yeah. Okay, now we're going to do your lower trapezius. So straight elbow. Let this relax right here because you have a movement pattern where you're wanting to squeeze that shoulder up to your ear. Did you feel that?
Yeah.
Yeah, that compromises the arthrokinematics of the joint. So straighten your elbow and then push straight down into your, there you go, right there. You feel how you can lock that now?
Yeah.
Go again, straight down. Yes, very good. Now go straight down this way. Go, 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 go. Yep, very good. So restoring the neutral alignment and the appropriate movement pattern to his glenohumeral joint, to his rib cage and his scapula and his forearm allowed those muscles to be activated again. And so we had to break down a more complex movement into smaller parts to get it accurate so that you can be able to do it without pain and actually strengthen the muscle you're trying to strengthen.
Yeah.
Instead of strengthening an adaptation pattern that's not really your triceps primarily. Yeah. Is that helpful?
Yeah, you have no idea how helpful that is.
So, yeah. So that's it. Do you guys have any questions?
Oh my God, like 1,000, but we don't have time for that.
Okay. Okay. Well, yeah, so that's what this is.
You
So-
are incredible.
You are a sweetheart. Well, it's really a pleasure to spend some time with you guys, and I appreciate your curiosity.
Yeah,
Enough
thank
to
you
show
both for
up.
coming.
Yeah. For you to be curious and want to know what are opportunities to learn, you know? Either this will speak to you or it doesn't. There's so much out there. But that you guys showed up really speaks to your potential.
Hunger.
Yeah. Hunger. Yeah. That's what it takes. You hungry and curious,
Oh, yeah.
start learning. Yeah. We're good. You were saying how it's interesting how it's really about troubleshooting.
Yes.
It's not like lay down and do something to me and just applying a technique, but there's a lot of problem solving.
Yeah, yeah.
There's a lot of inquiry, and that's what the system is. It's sort of like an algorithm. It's like
Yeah.
If this, then what? If this, then what? Did that make a change? Did that not? Do we do more of this, less of that?
Yeah. Yeah, because like looking at one problem, being like my shoulder hurts, and like somebody being like, let me just massage your shoulder, let me just stretch it or whatever. It's not the same as actually like the whole arm. Like when I started getting massages myself, it was because of a domino effect of like my back hurting, my hip, lower back, knee, like even shoulder. Like so, like this approach of like going through like the whole body instead of looking at like this one thing, but like as a treatment like option, you know, like instead of like, because yeah, obviously you break it down, you go from small to big, but like some people really just treat that like on one specific part.
Sure.
And to go through all the things that could be like doing that is just like that knowledge blows my mind first of all, and but it definitely got to what was hurting, you know, like
Yeah, the root of it.
exactly, yeah,
Yeah.
and the fact that you did it so quick was just, you know,
It's fun.
yeah.
Yeah.
So thank you
Yeah.
very much.
You're so welcome.